Hi friends, this is Jason Williams, DO. This is the Williams Family Medicine channel. This channel is for patients and healthcare providers that want to learn more about health span. Today's video is about fasting. Fasting is a very powerful strategy in order to improve metabolic health, obesity, and type 2 diabetes. Patients that see me in the office, I often discuss fasting. Fasting has been used for many years. People in the United States have adopted a policy of eating more frequent meals and smaller meals. This has been something that healthcare providers and nutritionists have recommended for quite some time. It would be very common for people to only eat a few times a day years ago, but now sometimes eating 6 to 8 or even more times daily is not uncommon. The benefits of fasting are many. This is not a complete exhaustive list, but these include people with obesity, metabolic syndrome, diabetes, fatty liver disease, dementia, inflammation of any kind, acid reflux, and gout. There are a few myths about fasting that should be at least addressed. One myth is that fasting will cause you to overeat. This has been looked at and studied, but never been found to be true. Another myth is that fasting will cause you to burn muscle. This is also not true in almost all cases. For comparison's sake, if you are an elite athlete and have a body fat of 8%, you're still not at risk for burning muscle, most likely. Scientists will say that you must be at the 4% range before you start burning muscle. Another myth about fasting is that if you fast, you will have decreased blood sugar and decreased nutrients. While it is true your blood sugar will likely decrease from where it was, it is unlikely that it will go into the danger zone unless you are fasting without discussing with your doctor your hypoglycemic medications. A proper diet when you're not fasting will likely help you to prevent any type of nutrient deficiency. There are certain people that should not fast, and those include children, women that are pregnant, women that are breastfeeding, and people that have a history of anorexia. You should exercise caution with fasting if you have gout, diabetes, or acid reflux. You should also exercise caution if you take any medications. You would need to discuss your medications with your doctor. It's a very simple process. You just don't eat. It's very convenient. You don't have to have anything with you. You don't have to buy any special products. You just don't eat. It's convenient. It can be done any time of the day, and it can be done different times of different days. Fasting can be done in conjunction with any other dietary program as well. Last but not least, you can still participate in celebrations, in off-plan eating if you fast. Just fast the day before and the day after the event, and you will likely come out even or even possibly ahead. In fasting, you're decreasing your insulin level, your glycogen stores, your circulating blood sugar. You're also increasing your cortisol level some, increasing your glucagon level. You will almost always decrease your LDL cholesterol if that is of concern to you. And in general, if your insulin level is low, you won't be able to store fat. If you compare fasting versus a caloric restriction diet, you'll see the advantage of fasting. Fasting does not seem to decrease your basic metabolic rate. There are many different patterns of fasting, including normal eating for 5 days and 2-day fasting, 16-hour, 20-hour, 24-hour, 36-hour, 42-hour, and even 7 and 14-day fasts. For people that have been on a more prolonged fast, they will notice that after day 2, their ghrelin level seems to go down and their hunger level also goes down in addition, and it becomes much easier to continue the fast. The first 2 days can be rough. The possible benefits of fasting besides fat loss and mental clarity is a process called autophagy, means body eating itself. This is a process where the body turns over damaged DNA, damaged cells, etc. The process of autophagy has been purported to decrease risk for cancer and other chronic inflammatory problems. It's not clear to me the duration of time you need to fast before your body reaches the point where autophagy occurs. Some experts say it must be at least 16 hours. Others disagree and say it must be at least 2 days. The process of fasting is to not eat food. During this time, you would become dehydrated and very weak if you're not careful. Of course, the longer you fast, the more risky it could be. We recommend fluids when fasting. These fluids include water, coffee, tea, and bone broth. You can add a small wedge of fruit to your water. You can add cream or butter to your coffee. I read about a company that makes a product that allows you to mimic fasting, meant to be used about every 4 months in about a 5 to 7 day stretch. Of course, you have to purchase this. A lot of this information came from Jason Fung's book, The Complete Guide to Fasting. Jason Fung is a Canadian nephrologist who stresses fasting for his patients. Please keep in mind that this information is medical information, but not direct medical advice for you unless you are my patient in my office. Please see your own doctor to discuss any kind of treatment changes that you might make. We will catch you on next video. Thank you.